Hey there everybody. In this video, I'm going to go over the CASPer exam. Now you guys may realize that the CASPer exam is being utilized by more and more schools in the medical school admissions process. It's a way for them to screen applicants without actually having to do a tremendous amount of work because they get a score and can decide who they're going to take on to the next step in their application process. You can find a link in the description below that talks about the schools that utilize CASPer today. So let's get into some specifics. What does CASPer even mean? Not the friendly ghost, but a computer-based assessment of sampling personal characteristics. It's an online test that's about 90 minutes long. It consists of 12 total stations, and each station is either a video or a text prompt followed by 2 to 3 questions. It's all online, and what you're going to do is you're going to see the video or you're going to read the text prompt, and then you're going to get 2 or 3 questions based on it, and you have to type up your responses. Those responses are then actually graded by somebody, and the final score is sent to a medical school for an assessment of you. Now, how do you study for this test? It's a question that a lot of students ask, and it's a good one. The reality is that CASPer is actually made not to study for like the MCAT. You're not going to spend months and months of time preparing for this exam. What you should do though is go over some scenarios and understand how you may approach them. We've actually come up with the MedSchoolCoach CASPer Prep and Coaching Program, which is perfect. It's going to take you about an hour to 2 to go through it. It's going to include physician advisor feedback, and it's going to get you as prepared as you can be for the CASPer exam. There's a link below in the description to help you prepare for this exam. Now let's go over some core principles of the CASPer exam. The CASPer exam is designed to test your ability to make appropriate decisions. As you go through your medical training, you're going to be put in all kinds of ethical dilemmas where you need to use your values and your upbringing to kind of make the right choices. Let's think about a few of these and how you may utilize them when you're actually studying for and taking the CASPer exam. So let's dive into medical ethics. There are 4 principles of medical ethics that we think you should know for the CASPer exam. The first, autonomy. The principle of autonomy refers to an individual's right to make decisions for themselves. Though there are many complexities to this principle, the key is that decisions made by individuals should be done without coercion or undue influence from anybody else. If, for example, a patient is deciding to have a particular medical treatment, it's your responsibility as a physician to educate that patient on the procedure and its associated risks, as well as the benefits. However, it's the patient's choice to have the procedure or not. How can this be incorporated with CASPer? Well, many CASPer scenarios will not be medically related. In fact, most of them aren't. But they have to do with everyday situations that people may face. During the exam, you can utilize the principles of autonomy by never forcing or demanding an individual to make a decision. Instead, you can educate, encourage, and help them to a particular decision. Now the next. Beneficence is the ultimate principle of a practicing physician. This is always trying to do good for the patient. It implies that a physician will always work in the best interest of any given patient that they see in front of them. Here's an example. A patient needs an operation, and there are 2 potential ways to perform it. The physician needs to perform the operation, which will give the best outcome to the patient and reduce their harm. Not the one that makes them the most money, not the one that's the coolest. Similar to working in the patient's best interest, try to always answer the questions in the best interest of the individual that is the subject of the scenario. If there's a way that you can help or assist the individual, then that is always the best course of action to take. Okay. The next principle is non-malfeasance. Most pre-meds have heard of this from the Hippocratic Oath, right? You should never harm a patient. This principle goes in hand with beneficence, as physicians should always work in the best interest of their patients while not causing harm. An example, a patient comes to the doctor's office for symptoms of the common cold and wants antibiotics. The physician does not believe antibiotics will help this patient. Although the patient wants the medicine, the physician doesn't provide them, because taking the medication could actually cause harm by unnecessary side effects. How can this be incorporated with the CASPer exam? Use non-malfeasance along with beneficence. As you try to help the individual in the scenario make the best decision, try to help them with a decision that will not ever hurt them. Okay, the next principle, justice. Justice is the 4th principle of medical ethics, but it's likely the one that's the most obscure for the CASPer exam. In a medical setting, this refers to equal treatment of every individual. Here's an example. An emergency room physician is seeing patients, and a homeless patient without medical insurance comes in for care. Using the principle of justice, the physician must see that patient and treat him regardless of his socioeconomic status and lack of insurance. Now, how can this be incorporated with the CASPer exam? Think of treating every individual fairly. For instance, if the scenario involves resolving conflicts between multiple people, treat them equally and do not give preference to any one individual. Now let's dive into decision making. As stated earlier, your ability to make decisions is largely based on your experience and your personal convictions. But here, let's cover some of the simple steps that you can take to make decision making during the CASPer exam. Think about the scenario. After you watch the video or read a prompt, take a couple of seconds to think about the scenario. Give yourself a few seconds to collect your thoughts before formulating your response. The next, understand the issue at hand. Each CASPer scenario has a central issue or problem that needs to be addressed. Try to determine what it is. Could it be a question of honesty? Could it be unfair treatment of an individual? Does it have to do with a personal question of how you handle stress or difficult situations? The next, get more information. Though you can't ask questions during the CASPer exam, if you feel like a scenario is lacking information or that more details would be helpful in this particular case, you can inquire about that. For instance, you could say, I would first ask the individual why they feel this way. That way you're demonstrating to the examiners the need to gather more information to make the best possible decision given the circumstances. Now, determine the course of action. Oftentimes, students just start answering these types of questions with a gut reaction. Instead of just responding, try to figure out what the best thing to do. This is where you can apply the ethical principles discussed earlier so that you can address the scenario by providing a solution that maximizes the positive outcome for all involved. Then write it out. Remember, you have 5 minutes to respond to the prompt. Use the 4 steps to organize your thoughts and then begin typing it out to develop a cohesive and thorough response. So I hope that's given you a nice overview of the CASPer exam and all the things that you need to think about for the actual test. Remember, we're here for you through our CASPer coaching and preparation, and it's an awesome product that's really going to give you everything you need to know about the CASPer exam. So check it out.